Hi class, I have another interesting case that I'd like to share. We're looking at a 10-year-old Hispanic patient who presented to our clinic for orthodontic treatment. This panoramic radiograph that you're currently seeing was taken back in October 25th of 2016. You can see that the date right here. And it was imported on January 11th of 2018. So this is, wow, so let's see, is it 2 years and 3 months ago? So that would make her to be around 7.5 years of age, roughly, since she's about 10 right now. Anyway, at this stage, why don't you take a look at the radiograph? First, we see the incisors are erupted, right? Permanent incisors. And premolars are forming and canines are forming. Okay, 12-year molars are developing. We're starting to see the follicle of number 17, and again primary molars. We have lost, okay, deciduous canine bilaterally, if you notice that. Okay, deciduous canines are missing. So we have a premature loss of deciduous canine. And now we're going to look at what that may have done to the patient's arch and the clinical consequence of prematurely losing maxillary canine, primary canine. Okay, so this is a great case to evaluate that. Again, here we've lost canine, primary canine as well, and the interdental distance is quickly narrowing in comparison to the contralateral side. So I hope you recognize that. And let me fast forward and look at another pantomograph that was taken January 11th of 2018. So this is taken about a year and a half later, and let me see if I can make the contrast better. I'm having a little difficulty for this to show up well. Okay. Well, this is as best as I can do. Let's try to focus our area to the maxillary canine. Okay. Let me double click. Do you see that the canine is certainly now erupting, right? It's coming down. At the same time, we are starting to see early signs of resorption on tooth number 7. Okay, the apical third of the root is resorbed from the follicle of tooth number 6. What about number 11 and its relationship to number 10? It's unclear, at least from the panoramic radiograph, whether there's a clear resorption or not. There could certainly appear to be resorption, right? But at least at this stage, number 10 looks better than number 7. So that was January of 2018. Let's see, we have periapical radiograph of this area taken on the same day. Clearly, right? Clearly we have lost a lot of, at least the apical third, if not apical half of number 7. And now we can better visualize the apex of number 10. This should be pretty convincing to all of you that we certainly have cause of resorption of number 10 at this point. Again, not as bad as the other side, but we've definitely lost some tooth structure there. Now, 2 months later, or 3 months later, this was taken March 26th of 2018. Not a whole lot of progression, okay, but definitely resorption is seen. Again, this is only 2 to 3 months later, so not a whole lot of change is noted. Luckily, it does seem that mandibular canines have erupted into its position nicely. And what I have is, okay, periapical film taken June of 2018. They look normal. The APCs appear a little bit short and blunted, but sometimes this trend appears to be more common in Hispanic populations. Okay, and this is the periapical radiograph that we took today. and unfortunately you can see that there's quite a bit more resorption, right? There's a lot of resorption involving the tooth number 7, and on this view, on this particular view, number 10 doesn't appear to be too bad, right? It doesn't appear to be too bad. But we've also taken a couple other projections in this area, and let me show you number 10, how it appears on periapical projection. Okay, if I can rotate that. There you go. Let's see, could I minimize that? There you go. So here's number 8 and number 9 and 10. And as you can see, the canine did cause quite a bit of resorption. Okay, and it's certainly worse than what we saw on the previous periapical radiograph. Again, if you're not sure, okay, how to determine which one's central, which one's lateral, some of you may have thought or could have thought that this is 8 and 9 instead. What helps me to know is obviously the anatomy. You see the anterior nasal spine and intermaxillary suture, and that helps me to recognize that this is tooth number 9 and this is tooth number 10. Okay, so yeah, it's unfortunate case with a lot of root resorption involving the lateral incisor. And I think the point of this video is that if you prematurely lose your primary canine, and that may cause the reduction of the arch size and severe crowding, therefore you may end up having unnecessarily severe root resorption, unfortunately seen in this case. So that's it for this particular video. I hope this was educational and helpful, and this is again my way of sharing interesting cases with the rest of the students. Okay, all right, thank you very much, and until next time, I'll see you later. Bye.